cover what budget to payment challenges we are currently seeing in the industry and what is involved with those. We will discuss also what the industry needs to focus on as a whole and how Medidata looks to combine data and our technology to help streamline the budget to payment process. From there, we'll recap for the group. So to begin, let's talk about the budget to payment process as we see it. It is like a relay race with multiple handoffs. Many of you on the line, they use spreadsheets or manual processes to develop your budgets, negotiate with your sites, and to make payments to those sites. The current process that most of you probably see is full of lots of challenges, can be very siloed, and there are various handoffs that take place between departments and divisions within your organization. Our goal today is to show you how Medidata has taken a streamlined approach to identify your schedule of activities, develop your budgets, negotiate your contracts, and calculate the appropriate payments to pay your sites. The industry needs to assure that there is no dropping of the baton in its critical business process. We have a very informative session planned for you today, so with that, I'm going to turn it over to Frank, our first speaker, to get started discussing some of the challenges we are currently seeing in the marketplace.
Thanks, Tim. Appreciate it, and thank you everyone for attending today. You know, our experience is that this process is full of challenges. Industry, whether it be a sponsor or a CRO working on behalf of a sponsor, are challenged in key areas of creating an accurate cost per patient site budget. You know, problems occur when using inconsistent data sources, reference information, price lists. And there's a need to have a solid basis and something that they are confident is meeting fair market value requirements for a particular study. The budgeting process can be extremely time-consuming as well, and it is potentially full of errors or error-prone, and that lack of often there's a lack of handoff between the protocol design to the team that is actually budgeting, and sponsors and CROs are looking for ways to create a more streamlined process. The ultimate goal is to ensure that the payment levels are appropriate. You know, not overpayment for site services, but conversely not underpayment for site services. The site needs to be paid appropriately. The price that is paid for specific services needs to be valid for the amount of work being requested of a site. And those site fees also need to be defensible. And sponsors are challenged with that, needing to meet regulatory requirements as far as fair market value compliance is concerned. And the obvious need, they need to manage an overall clinical budget or an individual study budget to make sure that the funds allocated for a study are available, and that comes in that planning and budgeting process. Next slide, please. We have a polling question at this point, and how many sites does your organization, site budgets, does your organization process in a year? Be interested to get your feedback to understand the relative impact to you as an organization. Is it less than 100, 100 to 250? Are there 1,000 budgets that are generated and processed each year for your organization? If you can take a moment to just click on an area that's appropriate with your organization, we'll be able to take a look at what the results look like.
Yes, thanks for that, Frank. And of course, the audience can vote in real time by clicking on your screens. I'll give the audience a few more seconds to vote. Again, the question is, how many site budgets does your organization process each year? And it looks as if most of the audience has voted. And so I'll now close the poll and just share the results.
Interesting. Poll results show that creating site budgets of less than 100 in a year, 38% of the attendees, to over 1,000. So a wide disparity, but a significant amount of impact on your overall study costs. Next slide, please. So, you know, that first step in the process is the budget. You know, and they need to, sites need to, or sponsors need to put together an accurate budget for a site that's appropriate and is at a fair market value. But the next step in the process that sponsors report to us in our experience is that they're challenged with is getting the site budget negotiated. This is a reference to a point that the #1 cause of study startup delay is the aspect of site negotiations. You know, in the past, email, spreadsheets, phone calls have been the process of negotiation of the end budget. There are multiple parties involved, the sponsor, maybe CRO as well, and the sites, and they're not engaged in a centralized exchange of information.